recording. A couple more housekeeping things. Participants, attendees, you guys will notice that your audio is off, and it is going to remain off the entire session. We'll use the chat function for any question and answer. For the best viewing experience, if you have not already done so, I recommend that you click your video box and then select hide non-video participants. That way you can see just the panelists on your screen. And with that being said, we will get started with the first sports physical therapy residency webinar. My name is Jack Malafronte. I am a physical therapist and athletic trainer and a sports PT resident at Texas Health Sports Medicine down here in Fort Worth, Texas. We are joined tonight by 7 lovely panelists from around the country, representing a variety of different sports residency programs. So without further ado, I'm going to introduce our panelists, let them tell you a little bit about themselves. Oh, and also just formatting for tonight, for people who are unaware, we're going to do a little bit of introduction for each panelist. We're going to do a moderated question and answer, and then we will finish with an audience question and answer. And as I mentioned previously, you guys can use the chat function to submit questions, and I will direct those questions to the panelists. So first we have, I'll give it a Lindsay. So we have Lindsay Gately. She is a resident at Memorial Hermann in Houston, Texas. Lindsay, why don't you just tell us a little bit about yourself and a little bit about your residency?
Yeah, thank you all of you guys for coming. My name is Lindsay Gately. I'm the current sports resident, like Jack said, at Memorial Hermann IRONMAN in Houston, Texas. I'm originally from Long Island, New York. I went on to get my athletic training degree at the University of Pittsburgh, where I became a certified athletic trainer. I completed my graduate PT education at the University of Southern California in LA, graduated in 2019, and knew I wanted to apply to sports residency programs. I knew I had the experience in the training room and some experience in PT school with developing plans of care, but I knew I wanted a synthesis of those two things. So I knew sports residency was kind of where I wanted to go. At Memorial Hermann, I'm one of 5 sports residents. And my current affiliations are with Houston Baptist University and George Ranch High School. And I'm sure we'll get into more specifics on each of our stuff later, but we have a great sports affiliation. We have a heavy research component, and we have a large, diverse faculty here at Memorial Hermann that are all SCS and OCS certified. But I'll go ahead and let some other people introduce themselves.
Awesome, Lindsay, thank you. We'll throw it to another fellow USC alum. Erika, why don't you tell us a little bit about yourself? Erika is a sports resident at the University of Southern California.
Hi guys, thanks for everyone for joining. I am from Kansas originally, so I was in the Midwest and actually went to the University of Missouri for undergrad. I ran track and field, I majored in health sciences, got a minor in psychology, and I knew for a while that I wanted to become a PT. I wanted to be able to help others, make a difference, and still work with athletes because I knew I wouldn't be doing that professionally. So I applied to USC's PT program and got in. Spent 3 years there and still wanted to go on the route of working with sports and athletics. So I applied to USC's sports residency program. So I went all the way through, no breaks, from undergrad, grad school to residency. I am one of 3 sports residents. We're all at different locations. I'll talk about that a little bit more later on. But yeah, it's been a great opportunity and I'm happy to give you guys some knowledge and experience on how it's been.
Thank you, Erika. Let's kick it across the DFW to Nick Mahaffey over in Dallas at UT Southwestern.
Yeah, like you said, my name's Nick. Thanks for joining us tonight, and thanks, Jack, for making this all happen and putting together. So yeah, I'm originally from North Carolina. I went to Appalachian State for undergrad. Worked for about 1.5 years as a tech in a clinic, and then I went back to PT school at Duke University, where I graduated last spring in 2019. obviously immediately pursued a sports residency. And now I'm down in Dallas doing the sports residency with UT Southwestern's Medical Center. I'm the only sport resident, but the school also has a couple other residencies in orthopedics, neuro, and cardiopulm. So yeah, my main event coverage and team coverage is with the Dallas Stars of the National Hockey League, and then I also work with Dallas Jesuit College Prep Academy to kind of get training room hours and other sport coverage. So yeah.
Awesome, Nick. Thank you. May Sheft is a sports PT resident at Vanderbilt and Belmont University, so in the great city of Nashville. May, why don't you tell us a little bit about yourself?
Hey guys, so my name on the flyer, Karen May Sheft. I go by May. Sorry for the confusion. So I actually went to Vanderbilt for undergrad. I'm originally from New Jersey, but fell in love with Nashville when I went to Vanderbilt for undergrad. So I knew I wanted to stay, which kind of led me going to Belmont for PT school. And I kind of knew right away my first year that I wanted to do a sport residency because I had worked with the football team during my 4 years at undergrad. I'm not an athletic trainer, but I just kind of weaseled my way in there. And so I knew I kind of wanted to stay in Nashville. I'm the only sport resident at Vanderbilt, and it kind of works with Vanderbilt and Belmont. So there's a heavy teaching component at Belmont, and then I work in the hospital in the outpatient at Vanderbilt, and then my sport coverage is with all of the athletic teams at Vanderbilt. So kind of whatever team is in season, where my interests lie, is where I kind of get to have all my sport coverage. And I went straight from undergrad to PT school to a residency, no breaks. I will let the next person kind of give their little intro. I don't want to go too long. I know there's going to be a lot of questions later on.
Yeah, absolutely. Thank you, May. Next up is Kyle Clark. He is at Atlanta Children's in Atlanta, Georgia. Kyle, tell us a little bit about yourself.
Yeah, hi. Thanks for putting this together, Jack. I appreciate it. It's nice to be with everyone here. I'm originally from Illinois, and then I went to school for undergrad at University of Wisconsin at La Crosse. And then I headed down to Duke with Nick, who was actually my roommate throughout PT school. So that was fun. Nice to see you here. And then from Duke, we graduated in May in 2019, and I came down to Atlanta. I started my residency here in August. So I went from undergrad to PT school to sports residency, just like some of these others. I've been here since August. I finish up in mid-September. I work at a children's hospital, like Jack said, so it's a little bit more unique. I can kind of get into more of the details of it, but I basically see 7 to 21-year-olds. So it's a kind of a niche sports specialization for me down here. So, yeah.
Awesome, Kyle. Thank you. We'll save the two mustached men for last. Let's go back to my hometown, Jake Fine at Northeastern University up in Boston, Massachusetts. Jake, tell us a little bit about yourself.
Hey, how's it going? Thanks for joining, guys. So yeah, like you said, my name's Jake. I'm currently in Boston doing my sports residency at MGH in Northeastern University. I'm originally from Pittsburgh. I ended up at the University of Maryland for my undergraduate degree, which I did in kinesiology. At the point when I graduated in 2014, I was slightly unsure what I was going to do, but I was always leaning towards PT. So like Nick, I took a year and a half off and worked as a rehab aide in a sports medicine facility back in Pittsburgh. And about a year and a half later, I started PT school at the University of Pittsburgh. So throughout school, I always knew I wanted to be in some sort of outpatient setting, and I was always drawn towards sports PT because, like most of us in this chat right now, I've been playing sports my whole life, or have been a fan of sports my whole life. And after getting some exposure to collegiate athletics in the training room environment during one of my last rotations as a PT student, I decided to pursue a sports residency. So I ended up graduating from Pitt in April of 2019, and I started my sports residency here in Boston in July of 2019. And very briefly, one of the things that I like about the Mass General and Northeastern residency is that they truly are two separate institutions, and they're really just blended together through the residency. So it's kind of the best of the both worlds, getting the benefits of a large hospital system through MGH, but also getting experience in Division I athletics and in an academic institution at Northeastern.
Thank you, Jake. And then last but not least is my co-resident down here in Fort Worth, Texas at Texas Health Sports Medicine, Trevor Kovacs. Trevor, you're muted.
Thank you, Jack. So as Jack said, my name's Trevor. I am one of the 5 current Texas Health Sports Medicine residents, and then we also have an athletic training residency. So there's 6 of us in total. I'm from Los Angeles, California. I went to Loyola Marymount University for my undergrad and studied health and human science. Took about a year off, was an aide, traveled a lot, and then went to school at USC for my DPT education. And then kind of, I'd say probably around second year, figured that I really wanted to do a residency. I wasn't quite sure if I wanted to do it in ortho or in sports. And once I figured that out, I decided to go the sports route, felt it was more for me. And then now I'm out here in Fort Worth, Texas at Texas Health Sports Medicine. And I'd say the sport that I like to treat the most is soccer players. And then 2 of the diagnoses that I like to treat and am doing research on are concussion and ACL reconstruction. So it's been a real pleasure to get this going and organize with Jack, and really happy that we have a big turnout tonight. So thanks for joining.
Awesome. Thank you guys for the brief intros. We'll obviously get more into your specific programs and kind of your experiences as we go through this. I really wanted to start one thing that I am curious about. I know most of you, I don't know all of you, but one thing I am curious about, Kyle, I want to talk about your residency a little bit. So I think there's a misconception, and I'm guilty of it myself, that Atlanta Children's Hospital, it is a pediatric residency, but it is in fact a sports residency. Can you just talk about, you mentioned you treat 7 to 21-year-olds. Who do you treat? What type of injuries do you see? And kind of dispel that myth that it is a pediatric residency.
Yeah, I mean, I'm pretty sure when you and I met at CSM, you thought I was a peds resident. There's 4. When I applied, there were 4 children's sports residencies. I believe there's actually 6 now. But it's a full-blown sports residency through children's hospitals. So at the time when I applied, it was Atlanta, Texas Children's in Houston, Nationwide in Columbus, and then Cincinnati in Cincinnati. And I believe they've added Denver and then one out in California maybe. But it's a sports residency just like the rest of everyone else here. It's not professional sport oriented like Nick does or like some of the other people do with universities. So it's all high school sport based, and then kind of get into a little bit of middle school and club sports with gymnastics and basketball and stuff like that. So it's different for me. It's something that I knew that I wanted to do pretty much from the start of PT school. I didn't really have an interest in doing some of the professional sports side of things. I love kids and I love sports. So marrying those two was awesome. But like you said, the myth of having a neuropeds residency is not true. I have not seen any peds specific diagnoses. So it's solid. It's fun, and the kids are great to be around. I haven't treated anyone born in 1999 or later, so it's kind of cool. So.
Thank you, Kyle. That helped me out a little bit, and that's really interesting. Obviously, as we start to hear the other people on the panel talk, it's a very different experience than potentially what other people have, but it serves a purpose if that's what you want. Lindsay, why don't you talk a little bit about your sport experiences, because I know that you also treat at a high school, but you also get the Division I setting as well. So can you speak to that a little bit? And we just lost her. She's
back. Yeah, absolutely. It's funny to hear you say nothing post 2000 because sometimes I'll open evals past 2000 all the time. So, and I'm not considered a pediatric residency by any means, but yeah, so my opportunities are both at Houston Baptist University, Division I college and located in Houston, as well as George Ranch High School. So they both provide opportunities that have helped me grow as a clinician in different ways. So I'll kind of go over the high school first and how it's kind of helped me develop. At the high school, there's a very high need for the resident. There's so many kids, and there's only 2 athletic trainers working for all the sports, especially this is turning into a 6A high school, which if you're not from Texas, which I didn't know because I'm not from Texas, means the more A's, the more people there are. So there's a lot of kids at the 6A high school. So you walk into the training room and the athletic trainers, the kids are so grateful for your time and your expertise, and you're there to help, which is great. Even on-field coverage from that side, I was involved in 3 different spine boards this past fall during football season, which is something you're just not going to be the next to person at the college level. There was even one where I ended up going all the way into the emergency room with our team physician. So that's something even as good experience I didn't get as an athletic training student. So at the high school, you're really more kind of in depth with being that person and being that on-field provider, which is something you don't always get at a higher level. Some cons of the high school, of course, is you're going to have less resources and you're going to have to deal with parents, which is something that not everyone really wants to do. It's not that it's a negative per se, but it's an additional challenge in dealing with some of the kids. So if you're not totally into that, I could see how it might be a new challenge for you. At the Division I level, even at Houston Baptist University, there's a little bit different vibe and demand at that level. Something I want to touch on too, real briefly, is that our other affiliations are with the University of Houston and San Houston State University. So this kind of applies to all the Division I schools that we all cover with all 5 of our residents. So a huge pro is that you're going to have an athletic trainer for every team. So this could be a pro in the sense that you may see the athlete 2 times a week in the clinic, and then the athletic trainer is going to be the one seeing them maybe up to 5 times a week. So you have increased accountability for that athlete. You know someone's kind of on their tail the rest of the week and carrying out maybe the plan of care you made together, the plan of care you made or the athletic trainer made, but you know that accountability for the athlete's there. So they're going to have that like lack of compliance that you might see at the high school level. On the flip side of that, with an athletic trainer with every sport, they're going to be super passionate and have a lot of pride in how they treat their individual team and athletes. So I think some of the cultural differences among sports is something that I've seen over time, and they'll be a little territorial at times. So at the college level, you're going to have to invest that additional time to show that you're not an idiot, right? Show that you're not condescending just because you have a different degree than these people. And you are going to have to be exposed to a lot of different multidisciplinary healthcare providers. So at high school level, it's basically me and the athletic trainers, where at the college level, I may have to meet with the strength coach, I may have to meet with the coaches, I may have to meet with the dietitian or team sports psychologist on a more regular basis. So those are kind of the pros and cons of those two different environments.
May, I would like you to speak a little bit. So you obviously are pretty heavily involved at Vandy with their athletics. And I think Lindsay kind of highlighted some of the difficulties of jumping into a Division I athletic training room. I know Lindsay is dual credentialed, so I think that potentially eases any tension. Can you speak to not being an athletic trainer, being just, being a PT, how you integrated into the athletic training room at Vandy?
Yeah, so that's actually that. I don't know if you knew this beforehand or not, but that's actually a pretty good point for the Vanderbilt one, because we're relatively new residency. I'm only the 5th one, and there has been a little bit of animosity originally when the residency started out between the DPT and the ATC. Just, unfamiliarity. They've never had a PT in the training room or anything like that before. But now that being the 5th one, I was a Vanderbilt undergrad. I had volunteered in the athletic training room during undergrad. I think it sort of helped me a little bit. I had established relationships or at least vague acquaintances with those individuals prior to acquiring the residency. So I think that helped me in terms of gaining their trust. But I know the residents before me didn't have that prior relationship with them. And much of what Lindsay said, you kind of do have to prove yourself in terms of that you're not an idiot, but also walk the fine line of not trying to take over any athletic trainer's position. I think that the DPTs have really established a good connection with the Vanderbilt athletic trainers, because pretty much when I'm there, I'm given free reign. Every athletic trainer trusts me in the sense that I get referrals from all sports. I see, people who are just drafted, for NBA, or who are going to be drafted in NBA draft, NFL, Vanderbilt baseball, they all trust the DPT at this point, no matter the level of the athlete. So definitely in the beginning, prove yourself. You kind of have to let the athletic trainers come to you. And then once they kind of see your outcomes with the students, it only takes a couple of months. Then you just get this influx of individuals, because the Vanderbilt training room is actually pretty understaffed. Vanderbilt, we're not exactly the powerhouse of the SEC or anything. So once they see that you're not going to hurt their athletes, they kind of open the doors, because they need the help. They need more hands. So just kind of making sure that you respect the athletic trainers, because I've learned so much from them that as a first year out of PT school, some of those guys have been there for so long. They have way more experience than I do. So I think just kind of showing that you're willing to learn from the people who've been there already has really helped to kind of establish that really good relationship in the training room. I don't know if this is a pro or a con, but you're the only physical therapist in the training room. So you're kind of on your own there in terms of PT related, like rehab progressions in the training room. You get all your mentorship when you're in the hospital with those PTs. So when you're in the training room, you are kind of the authority. And if they are confused about a rehab program, or they're not quite sure, they'll come to you at this point. They might not have done that 4 years ago, but on the 5th resident, they're kind of like, all right, we trust these PTs. Like, they know what they're talking about. So I think the relationship has gotten a lot better. So it's not as difficult as it used to be to assimilate. I'll just put it short that way.
I think that's great, though. I think that's a huge point. All of us want to be sports physical therapists, or we are sports physical therapists pursuing the residency. You're more than likely going to interact with athletic trainers, either on a day-to-day basis, or at least, via email, via phone call, because you're treating someone's athlete in the PT clinic. So being able to establish that relationship is important. And I think knowing what you do know, but also knowing what you don't know, is very important. And I think most of you guys would agree with that. Hi, Christina. I just saw her walk behind Trevor. So shifting gears a little bit, I want to ask you a question, Erika. I know at USC that you guys have 3 residents, but I know that all of your residents treat out of 3 different clinics, and then you have 3 different sports affiliations. So can you just talk about kind of how that impacts your residency? And, do you think all 3 experiences are the same, or how are they different? Just talk about that a little bit.
Yeah, for sure. So like you said, each resident is at a different location, both in the clinic and with sports coverage. So I am at Select Physical Therapy in LA, and it's actually located in the Curl and Jobe facility. So that's really nice for me, because a lot of the Curl and Jobe surgeons are sending down their athletes that they work with, basically from the adolescents to the professional level, to work with us. So I think I do see maybe a little bit more of the athletic population than the other 2 residents in the clinic, which is really helpful for me. It's a very fast-paced clinic, so you learn to become very efficient with your time and how you're treating your patients. So that's been really helpful in helping me grow into a better PT there. My sports coverage, I am with West LA College, which is a community college, and then Crenshaw High School, which is an inner city high school in LA area. West LA College and the Crenshaw High School, you can be very creative, kind of as Lindsay was mentioning. They're happy to have you, and so you can kind of be creative with your treatment programs and try new things and collaborate with one another. They've been very open to having a PT come in and getting that perspective, and I've been open from learning from them as well, since I'm not an AT. So it's been a very helpful experience. Also with Select, you do have the opportunity to work with the South Bay Lakers G League. I didn't get to do that this year because of COVID, but it is an opportunity if you work at that clinic. And then there are 2 other residents. So there's the resident that works on USC's campus. She works on the main campus, so her clinic mostly sees students and faculty members within the clinic. She'll see about 10 to 17 people per day, depending on how long she's there. And then she also works with a local community college, East LA College, in the fall for their football season. And then she also has the opportunity to work more with USC faculty since she is on the campus. So she's found that to be a plus with like her mentoring and just asking questions when she needs to because they're readily available. And then she also works with Rose Bowl Aquatics, which is like a walk-in clinic. So she gets more sports coverage there. And she may advise them on a few exercises. She may just educate them, or she could refer them to PT or to see a physician. And then similarly, she also works with club sports for USC. So she goes to the USC gym and does that 6 hours a week. And that's where she gets a lot of her sports specific training in. So that's kind of more about the USC site. And then there's also St. John's, which is an outpatient setting that our 3rd resident is at. And he works with Pepperdine University, so D1 University, and then Dorsey High School, which is in the same conference as Crenshaw. So I did get to see him in a few football games. And so he got the D1 college experience, whereas we got more of the community college experience. And then within his clinic, he's really liked it because they've really catered his caseload to involve a lot of the athletic population getting on his schedule, just so he can get more out of the sports residency experience. And then he also would have had the opportunity to work with the NCAA basketball tournament this year, had COVID not taken place. But yeah, those are opportunities for the residents at different locations. That's kind of how we vary. And we're still similar in that we're all seeing mostly orthopedic conditions. We're all still seeing the athletic population. It's just not the same exact setting.
Erika, a couple of follow-ups. Do you guys have a choice of where you're placed? And then second question is there any rotation throughout the year, or are you placed somewhere and you're there for the entire residency?
Yeah, so you do not have the choice to choose like where you end up. They do tell you where you're going to end up, and you can choose to accept or not. And then you don't rotate throughout the year. So you kind of just learn from other people and their experiences, but you don't have the opportunity to rotate between locations.
Awesome. Nick, I wasn't forgetting about you over there. I see you almost fell asleep up there. I want to talk to you about your experience with the Dallas Stars. So you are the only one on the panel who works with the professional sports team. I believe that's correct. So talk to us about that and what it's like. We've kind of heard the high school thing. I think Jake and Trevor might be able to talk about the college setting more as well. But you obviously work in the professional setting. What is that like?
Yeah, it's definitely unique. And I mean, I had a little background going back to PT school with Duke. I had an opportunity to work with the Hurricanes. So for a couple of years when I was in school, and I loved the hockey world, and I just loved the connections that I made within it. And so it was something I wanted to keep pursuing. So that's kind of what led me to sought out this specific residency when I was applying. And it's very unique because it's a relatively newer one too. I think I'm the 6th resident. And so how it developed was the team physician was with UT Southwestern at the time that the residency got developed, and he really valued having the PT resident kind of come in and work with the Stars. And that relationship has only grown, over the years. And so it's been nice to see actually one of the second resident to ever go through the program is now full-time working for the Dallas Stars as a physical therapist. So he's also still on faculty as a mentor as a part of my residency. And so, every time I'm with the stars, I'm with him. And so it's a good blend of mentorship and actually getting hands-on experience. And so I think the professional environment it provides, some unique circumstances and that you don't get to see everywhere else. I think there is pros and cons to it. Overall, it's just, I think it's just a great learning, environment itself, because I'm coming in there pretty low on the totem pole, and I'm just trying to learn. I'm trying to take in as much information as I can and grow from the experiences of everybody around me. And the beauty of that is that that's anywhere from the 5 or 6 physicians we have at every game to the 2 full-time athletic trainers they have with the team, or the strength coach, or the dietitian, the psychologist. I get to see it all and see it at a level that obviously is being performed at the highest level, and so the care, I guess, is at the highest level as well. And so that's been awesome for me. It's sometimes intimidating to get into a locker room, and maybe that's one of the cons of it, is that within any locker room, but I think definitely in a professional setting, you have to gain the trust of the athletes and the staff and everyone around you. And so it does take some time to, get your feet wet and get comfortable with that. But as the year goes on, that relationship grows and the opportunities open up more and more to do things. It's been a really fun environment, good learning opportunity. And then, like I said, it's not my only experience, it's just my main one. So my other one that I am involved with is at the high school level. It's a Dallas Jesuit private school. At the 6A level, they compete in all athletics. So I'm there 2 mornings a week in their training room. And it's kind of what Lindsay was saying, in terms of they need the help, they need the hands. And so a lot more autonomy in terms of being a clinician, and not as much maybe mentorship, but just getting your hands dirty and learning how to be a PT in that fast-paced environment while working alongside athletic trainers. So I think it's been a good balance, and I really enjoyed it. Yeah.
Awesome, Nick. Do you, working for the Dallas Stars, do you have an inside scoop when the NHL is coming back, or are you not privy to say?
No inside scoop, but I hope it's soon, man. I hope it's real soon.
I agree. The Bruins were in first place in the league. Not bitter about it. 2 other things. So we haven't talked to Jake and we haven't talked to Trevor individually yet. And I think they both can highlight some different things that I want to touch on. So Jake, a huge part of a lot of residencies is teaching. And I know it is a reason why some people do go on to pursue a residency, or at least part of the reason. So can you talk about your teaching experiences at Northeastern in their PT program?
Yeah, absolutely. And actually, before we talk about this was one of the things that I looked into pretty heavily before I was applying to sports residency, because I always went into it knowing that one of my career goals is to be a clinician educator and kind of eventually have a 50-50 split between either an outpatient sports setting or training room setting, and also being in an academic setting within a physical therapy department. And MGH really did check those boxes. So there's a couple of types of teaching that I do. The first being in the classroom setting. Northeastern University allows us the opportunity to come in and act as TAs for 2 to 3 of their physical therapy classes, and most of that is done within the musculoskeletal curriculum. And a lot of that is up to us on how much we want to get involved, depending on our interest in teaching. So there were some opportunities where I had to actually take the lead on some of the lab material. And most of my role is really just there to provide hands and to provide help for all the students and to answer questions. So that was the musculoskeletal courses is really our main classroom teaching experience. But then there's also a neat program called the Sports Concentration at Northeastern University, which are students who I'm sure are on this call who are really interested in pursuing a career in sports physical therapy. And it kind of gets them started getting some of those experiences. So I had the opportunity to do a little bit of clinical teaching, because part of this program is that the students will come into the Northeastern training room with us, and they'll also come to Northeastern event coverage with us. So that gives them the opportunity to kind of pick my brain about what sports residency is all about and why I chose to get in that. But we also get into more specific topics about how to manage certain conditions and what to do in certain emergency situations. And they're really there shadowing me rather than the athletic trainers, because that's the specific role they want to be in. So I would say that the teaching aspect, that most residencies have some degree of that. Some of them don't, because they're not associated with a residency, but it's really depending on what you want to do with your career. And it really fit my career goals to get more teaching experience, because that fit with what I wanted to do after my sports residency.
That's great, Jake. I also teach as well. I know Nick teaches, a couple other people on here teach. So I will definitely echo those sentiments. If you're interested in teaching, you want to investigate the residency programs and figure out what their opportunities are. Because, some programs have them, some programs don't. But if it's an interest of yours, it should be part of your residency. And then Trevor, one thing that we haven't touched on is research. So can you talk about some of the research that we do at Texas Health Sports Medicine, and then also how we incorporate TCU, Texas Christian University, their athletes into our research as well, and kind of that blend that we have?
Yeah, so I think that's one really interesting component of our residency. Like Jack said, and like he's wearing a TCU polo, we do our sport coverage with TCU, and we have a really good and strong connection with them that's kind of fostered over the years. And we have a PT, Bobby, that is in-house with them 4 days a week, and she manages their long-term rehabs, and that's where we get a lot of our athlete specific exposure. But in terms of the research component, I didn't do any research in undergrad or in PT school, and didn't think it was sort of a strong interest of mine. But being here at Texas Health, I've really found to enjoy it and kind of realize that there's so many benefits to being part of an institution that does so much clinical research. And I'd say our two main focuses are baseball players and then ACL research, along with concussion as well. So I think it's really interesting to be a PT here, because we're always learning about the latest trends, and we're doing that with our patients. So, we tend to test our ACL reconstructions at 3 months, 6 months, and then return to sport, and a few other points along the way. So those patients that are in the research studies, we're at those time points getting their biodexes so we can know their strength. We're getting their 3D motion capture so we can know if they're landing symmetrically or whatnot, so range of motion, things like that. So it's really, really interesting to be a part of a program like this and really help further the field. And we have a lot of great leaders in our organization that help us. Every week, we're doing clinical research, and that's kind of built into our schedule and throughout the day, and kind of all the PTs are on board. So it's really nice to be a part of a culture and sort of continue the education in the PT field.
Thanks, Trevor. I want to hit on one point that you mentioned. So I myself did not do any research in undergrad or grad school. It wasn't really something that I thought interested me. And I think that's a question that we got a lot during the registration was, what if I haven't done research, or what if I'm not sure if I want to do research? And I think that, at Texas Health, we do a bunch of research, and neither of us had experience. So, and then I'm sure there are other panelists on here who maybe aren't doing a ton of research. So you can have a bunch of research in grad school, and that can be a great advantage to you, but you also can kind of learn on the fly if you do research in residency. I think that is a good point to bring up. Right now, I want to shift gears to the question and answer session from the audience. So we have almost 200 people here viewing us, unless they've all turned their computers on and walked away to make dinner, which is probably more likely. So guys, I've gotten a few questions here in the chat. If you have more questions, feel free to send them to me via the chat. I will try to direct some of these questions to our panelists. The first one comes from Michael, and he wants to know if you are in the training room and you potentially don't have any mentorship at the time, how do you deal with someone coming up with you and asking a question that you're not sure how to answer or how to handle? I think this is probably the best question for someone who's at a high school. So Lindsay, why don't you take it first, and if anyone wants to chime in, but basically dealing with being in a setting where you may not have any mentorship or guidance.
Yeah, and I think a lot of us practice in states that have direct access, so I think some of those same rules apply. You got to first screen out, like, is this something I need to get out of the training room right away? Do I need to refer to a physician on the spot? Especially, do I need to talk to the parent of the high school student? So as soon as all those things are cleared out, you look at the person and you just see, is there anything that requires a higher level of care beyond what I can give them right here? That's the most important thing. If there's something I can make them better on the spot with, I'm going to do that. And if it's something I don't quite have enough time to address their entire issue in one session, I'm going to do my best, get my best evaluation, even if I don't get to as much treatment as I would like in a PT setting where I have a whole hour. And I'm going to convey that plan to the athletic trainer as best as possible so they at least have a consistent plan the rest of the week until I can return again.
Anyone else have anything to add there?
I think that this happens even though the athletic trainers are pretty experienced at Vanderbilt. I am the only PT there, and I don't have any PT mentors there. So when these questions do arise, I mean, I'm pretty honest with them. I'll say, the honesty is the best policy, in this case. You're trying to build relationships with them. So I will say, I'm not quite sure. Why don't we look it up together? Or, try and engage the athletic trainer in what you're trying to look at. And I find they think they're more open to that, because then they don't feel like you are above them, or because you're not at all. They don't feel like you are just, teaching them or something like that. So if I don't know the answer to a question, I'm just very honest and say, you know what? I haven't seen that before. I'm not quite sure. Why don't we go look it up?
Awesome. Let's see. I just got bombarded with questions, so let's try to let's do a quick round the clock here. How long is everyone's residency? Nick, why don't you start?
12 months. September to September.
Erika.
12 months, August to August.
May.
18 months, around July or August, whenever you take your boards, to December-ish, late December.
Trevor.
August to August, 12 months.
Kyle.
13 months, August to September.
Lindsay.
13 months as well, August to September.
And then Jake.
Ours is also 13 months. It's beginning of July to end of July.
Awesome. So I'm seeing, and we got this question quite a bit on the on the registration form, asking about the difference between orthopedic and sports residencies, and trying to weigh the options, and kind of what made us choose a sports residency. I would actually like to start on this one because I am an athletic trainer. So I had quite a few people tell me that it was my best interest to pursue an orthopedic residency, because the sports residency with the event coverage and that sports experience overlaps in some ways with athletic training education and experience. But I can tell you that being in this residency, the sport experience is vastly different than when I was in athletic training school, and my knowledge level is so much different than when I was in athletic training school. So I think I appreciate the experiences more. And then also the biggest deciding factor for me was I thought about what I wanted to do with the rest of my life. I know, scary thought. but I thought about who I wanted to treat and the settings that I wanted to be in. And I never have seen myself treating in a standard outpatient orthopedic clinic, kind of treating whatever walks in the door. I've always wanted to either work with a team, work in a college, and specifically treat athletes. So then, for me, the decision was made right there. Why would I do an orthopedic residency if I know I want to treat athletes and high-level athletes? So I chose to do sports residency. I don't know if anyone, Trevor, I know that you had a little bit of a ongoing debate when you were applying between orthopedic and sports. Can you just speak to that a little bit?
Yeah, I'd say it's pretty common once you get down to the application process that you're kind of on the fence, because there's definitely are tons of similarities between the two. And, there are programs that have both sports and orthopedics, and they look very similar, except for the sports are doing extra coverage on the weekends, things like that. Jack kind of hit the nail on the head. Is I really wanted to treat high-level athletes at a collegiate setting or professional setting. And I felt that sports residency was going to be the best way for me to get there. We have such a high volume of athletes that we see through TCU in the clinic. My caseload is about 80% plus of athletes last time I looked at the numbers. And so I just figured that was a much better setting for me rather than taking the orthopedic route.
I think another question I've seen here, we got this a lot as well, talking about going straight from grad school into residency. So I think we all went from grad school straight into residency. So none of us can speak to taking some time off. But Erika, why don't you speak to why you chose to go straight into a residency and kind of how you made that decision?
Yeah. I mean, one huge thing for me was I was already kind of in school mode. So I was like, okay, I'll be able to keep my mind right and really dive into residency. And I probably wouldn't be as overwhelmed as I would be if I took a couple years off, because it is an intense 12 months. You're really grinding and learning and working hard. So that was a main thing for me. And then also, I'm just not a patient person. I want to get to where I want to go quickly. So I knew I wanted to work with athletes. I didn't really want to spend time working in a clinic where I wasn't completely happy. So I thought this would be a great opportunity for me to dive in early on, at least get the experience and build connections and learn and grow from people that have the experience in the sports setting. That way I can set myself up for success in the future.
Awesome. Thank you, Erika. Nick and Kyle, why don't you guys talk about not being, so this is another question that we got from multiple people, is how do you handle not being an athletic trainer going into sports residency? And then do you feel like the EMR or EMT course was sufficient and gave you enough of a kind of foundation to build on?
Yeah, this was a constant conversation between Nick and I, because we were obviously, living together when we were looking into it and applying. So I'll kind of let Nick talk about it a little more, because I think he asked a lot of more questions to a lot of different people. But just quickly for me, I haven't had a problem with it. The athletic trainers that I work with are pretty open to questions like the girls were talking about earlier. So it really hasn't been a problem for me not being an athletic trainer. That really wasn't a major concern for me. But I'll kind of let Nick talk about it a little more. I think he has a little more information on it.
Yeah, I mean, I would say, first and foremost, we have to respect the differences as much as we can acknowledge our similarities as well within, the sports setting. So I'm not out there to try to be an athletic trainer, but I am trying to be a sports medicine provider, and they're also trying to be a sports medicine provider, but just with a different background and education and title. And so what their strengths are, maybe I'm weak in, and vice versa. So I think it's just a matter of respecting that and learning from each other. And I haven't been in a setting yet where I feel like I've had to play both roles or both hats. And I don't think that's fair to anyone who tries to do that. But as far as the skills of having that EMR certification or ERA or whatever you want to call it, that's definitely going to be key in a sports setting if you're going to be working in an environment where you're seeing acute injuries, or you're providing coverage as a healthcare provider at an event. And so, we've had instances. We had a spine board, this year in hockey. And so just being, again, knowing your role, knowing kind of who's around you and who's on your team, but just feeling comfortable and not scared of what to do, and kind of best case scenario kind of mentality of you want to make the right decisions and respect who's above you and knows more than you. So yeah, I haven't run into an issue. I think it's going kind of back to your last question. It's why I wanted to pursue a sports residency right off the bat, though, is because I didn't have that ATC background and experience, and so I wanted to work with teams, and I felt like the sports residency would provide that experience for me.
Any of our other non-ATC panelists want to chime in there? Because I think that is it's a common question. I'm not an athletic trainer. Is it even possible for me to get into a PT residency?
I can talk about it a little bit, because I had the same concerns. I'm not an athletic trainer. And one thing that I quickly found out is that it's not a requirement at the grand majority of all of the sports residencies. They don't necessarily care that you're an athletic trainer. It doesn't hurt that you're an athletic trainer for the interview and application process. And I'm sure it does nothing but help in kind of managing the acute management side of these musculoskeletal injuries. But it definitely doesn't rule you out as a candidate if you're not an athletic trainer. And it's a good reason to pursue a sports residency, like Nick said, is because we, as PT students, we don't have the experience of that acute and sideline management. So if that's something you want to get into, this is really a good secondary way to get that experience.
That was great, Jake. Thank you. So let's see here. What else do we have? Let's do another rapid fire one. Let's just go around the clock. We've had some questions about our work days and how many hours we work. Let's do like an average estimate. How many hours per week are you guys working? Kyle, let's start with you. Let's say pre everything that is going on right now. Normal, average.
Yeah. I mean, I feel like everyone's going to have a similar response. That's a hard question to answer. Generally, somewhere between 40 and 50. I mean, somewhere in there. I don't ever feel burnt out, but I love what I do, so it doesn't feel like I'm just getting dragged down. There are long weeks and there are long days, but it's not, for me, it's not that bad. So,
Trevor.
Like you said, it really varies. I would say, depending on if you're with a team that's in season, I'd say probably about 50 to 60 hours. There's a couple instances this year when I was with beach volleyball and they had a tournament, and then soccer also had stuff. So I was kind of bouncing back between things, but it does vary. But like Kyle said, it's really enjoyable work. So it doesn't feel like you're working that much.
Erika.
I would say probably the same, about 40 to 50 between being in the clinic and then sports coverage, depending on the season. I was definitely putting in longer hours and longer days when football season was around, and then it kind of calmed down a little bit once it got to basketball and baseball. So it depends on the time of the year, the sport. But yeah, between 40 and 50.
May.
So I would say Vanderbilt, there's a lot of requirements. I probably spend about 70-ish or not more working, because all of our on the field coverage is on your own time. It's not built in during the workday. So we don't get a decreased amount of pay. We just work extra hours. Sorry.
Nick, what about you?
I would say probably somewhere between the 50 and 60, just depending on how many hockey games there are in that week. But it's gotten above the 65 to 70 mark too.
Lindsay?
Yeah, just to break it up by different categories, I'd say like 27 hours a week in the clinic for me, 8 hours guaranteed in the college training room, 4 hours guaranteed in the high school training room, and then anywhere from 5, 10, 15 to 20 hours per week in coverage, depending on the season and sport you're covering.
And then Jake.
I would say same thing. It kind of depends on the week, but average probably like 60 hours. Just to mimic what some of the other guys were saying is it never really feels like 60 hours because like you guys were doing so many different things and our days aren't just like 14 hours at one clinic. You know, we're doing 3 different things and could be in 3 to 4 different settings in one day. So
I definitely want to echo that sentiment, Jake. I never, like Trevor, I mean, obviously same residency, we work about the same 50 to 60, depending on if you're working with women's basketball and you're traveling and working like way more than that. But we're in so many different settings. And I think most people on this panel would agree is you're in so many different settings, whether you're teaching, you're in the clinic, you're at the university, you're with your professional sports team, you're with your high school. So working a 12-hour day is not that bad when you're in 3 different places, because it feels like you have 3 mini days. At least that's what I tell myself. So I think that really does break things up well, and kind of makes the days go by faster. And then like everyone else said, I love what I do. And I think everyone on this panel loves what they do. So I don't think anyone here is ever like counting hours. Like, I can't believe I worked so much this week or this weekend or whatever. 7:58. We have time for 1 or 2 more. Let me see. I know some of these are getting sent to the chat for everyone. So if
I'm gonna try to answer some of those too.
If any of the panelists see a really good question in the chat, feel free to say.
I think one thing we saw a lot in the pre-webinar, and then that I've seen once or twice in the chat is, how did we choose the residencies that we wanted to apply to? There are, I think, about in between 40 and 50 now. So I think that's a really good question that, how do you narrow it down?
Yeah, Trevor, I think that is a really good question. I think everyone is going to have a little different answer about what they were looking for. I think the biggest takeaway, and people can feel free to chime in here, but I think we all probably figured out what we wanted in a program. Jake mentioned teaching. Nick obviously has an experience with a professional sports team. Trevor and I are at TCU, pretty integrated. So finding out what you want out of a residency, I think is kind of step one. If you just kind of shoot blindly and apply to a bunch of programs, you may get into different programs and, go to a program. But if you have not vetted the programs for what you want, you may not have an enjoyable experience. Kyle obviously wanted to work with younger athletes, so he chose a pediatric sports residency. And I think that's important. Anyone else want to chime in on that?
Yeah, I will say one of the easiest things, like you said, it's very individualized, but the RFPTCAS website has a lot of really good information on it. And like you guys said, there's only 40 to 50 residencies. So kind of creating an outline about the general things that you want to get out of your residency, and then really just combing through that website and going to each individual program's website to see if it kind of fits that criteria that you're looking for. And that's how I went about it initially, is really just going through the RFPTCAS site and kind of narrowing in on a few programs that met all of my requirements.
Yeah, and I would add to that too. Start that process early on. You can never start looking early enough. And once you find something you like, reach out to the resident or the director, or try to meet up with them at CSM if you're going, something like that, just to match a name with a face and just get all the information you can.
That's a really great point, Nick. I think that's part of the reason we're doing this, right? We're bringing you the face of 7 different residency programs across the country. But, there's 40 other programs that are not represented on this panel. And, do your research and then make some phone calls, make some, if you have the chance to meet residency directors or current residents, do that. Because, you can look all day on a website. but until you actually talk to the people involved and understand what the experience is like, you're not going to completely know the program that you're applying to.
Yeah, one thing I want to just add to that is past residents as well. So any past residents that you can connect with or whatever, that's a great addition too.
Kyle, let's spin off that. This is a question that we got prior, and I think we have one more after this, but can everyone just mention some of the places that their past residents have ended up? Because that's a question we got, is where do people go after residency? So Kyle, I know you guys, why don't you start, like where do some of your residents, or where have some of your residents ended up?
Yeah, I'll just kind of be quick here. There's a couple that still work at CHOA down here, a couple that work in different children's hospitals across the country, and then one is the current overhead athlete fellow for the Toronto Blue Jays. So there is, for those of you that think you can't do professional sports, there is an opportunity there too. So,
Jake, what about you? MGH Northeastern.
Yeah, so there's quite some variety. You know, some are working in outpatient sports-oriented clinics. There's a couple who've moved on to manual therapy fellowships or Division I fellowships, and then there's a couple who went directly into baseball. And our previous resident from last year is working with the Arizona Diamondbacks currently.
Awesome. Lindsay?
Yeah, we have variety of places that people have ended up. A lot of people will stay in the system and continue to grow our residency or go on to grow other residencies. I know two off the top of my head. We have one resident from last year doing an internship with the Colts in the NFL. And then we have another resident a few years ago, went on to do an upper extremity fellowship and is now actually the head rehab coordinator of the Marlins down in Florida.
Erika?
Yeah, kind of the same thing. Some have stayed within the system. Some have become professors within the USC system as well. We have a couple other faculty members that have gone on to work with the Angels. So there are opportunities to either stay involved within the program or the clinic that you're at, or you could even go to work at the professional level as well.
Mahaff, what do you got for me?
So two work for sports medicine, orthopedic practices, two work for NHL teams, and one works for Division I college.
And Trevor, last but not least, Texas Health, where do our residents end up?
Yeah, so a lot stay on. Those ones typically stay so they can further their research development, just because we have a strong backing. And then one of last year's residents is one of the minor leagues PTs for the White Sox. We have one who's the head PT for the New York Mets, and then a couple sprinkled around the country in outpatient sports clinics, things like that.
Yeah, we have a couple former residents that are also getting PhDs in Ohio, one at University of Toledo and one at Ohio State. Actually, that's not true. Dave never did the residency. Dave, if you're watching this, I just gave you a residency and you didn't do one. But we also have a former resident who is actually starting her own sports residency program. This is my shameless plug for a friend. So University of Toledo is starting a sports residency program. So please all check that out. But that's great. Did I go to everyone? Did I go to May? Did I go to you yet? No, May.
No, it's okay.
Bring us home.
I mean, it's all very similar. We have one, the most recent went on to do her PhD. Another girl's with the Mets. One guy's with the Bruins. Another did a brief stint. I forget what professional team he was with, but now he started his own sports training facility in Nashville. And that's it. And there's me.
That's awesome. That's great, guys. A very obviously successful group of past residents from all of our programs. It's about it's almost 8:10 right now. So we're going to wrap up here because we have session 2 of the webinar to put on in just a few minutes. Does anyone from the panel have some last thoughts or comments that they want to make to all of the attendees here.
I would say, just because I feel like probably the majority of the audience is students, but I think, you know, the common question is how can you make yourself stand out, and what can you do to put yourself in this position to get a residency? And I think it's maybe it's common sense, but in the sports world, you just have to put yourself out there, and you have to do the extra stuff, you know. But and that's, you know, not breaking news to anyone, because if you're into sports medicine and trying to get into a sports residency, you probably already figured that out. But that's really, I don't think there's any secret. I think it's just a matter of doing it, and, you know, let your passion kind of take you there, and do the extra things, go the extra mile. You know, don't be afraid of reaching out, because that's really what's going to get you places.
That was awesome. That was a great way to end. That was very rah-rah, Nick. Did you have that? Did you have that written out?
Yeah, I had that. That was in the back pocket.
All right, guys, thank you for joining. It was unbelievable turnout. And, you know, thank you to the panelists for taking time out of their evenings. I know things are crazy right now, so I really do appreciate it. The recording will hopefully be on YouTube. So be on the lookout for that. I will try to email everyone once the recordings are posted. And also, we will provide you guys with a contact list for all the panelists. So if you have any more questions, or you want to reach out to a specific program, a specific resident, you'll have our information. You can email us, find us on social media, whatever you need to do. Thank you guys so much for joining us, and have a great week. Stay safe. Wash your hands.
Thanks for having us, Jack.
Thank you, guys.